This video I'm going to show you how to count your grafts in a transplanted area. Hi guys, today is day 3 of my hair transplant. It's healing really well. I'm really happy the way I'm progressing. Issues which happened yesterday, which is on day 2, when I opened the dressing, is the scalp was little bit sore. That means when I was lying down on a pillow to sleep, it was giving me some weird sensation. But nonetheless, it was comfortable, it was not painful. It is just because there is a raw area. Sometimes you feel the towel is getting stuck to your scalp, but that is okay. And you have to get a very thick layer of visiting ointment, and that solves the problem. Second issue is that I'm used to sleep on one side, and since 2-3 days it's been advised to sleep straight. There was a little bit problem which you guys may also feel, but it should be fine. It is not something which is not doable. Now I'm again going to spray my scalp. A very beautiful incident happened, and interestingly I can now correlate with the questions and apprehensions which patients face after hair transplant. One of my billing mate came and approached me. He doesn't know that I myself is a hair transplant surgeon, and he told me that this cannot be a 3000 graft, it looks it's 2000 graft. It was good on my side at least that I know what work I have undergone, so I don't have that doubt in my mind. But this can come to anyone's mind if someone says to him that this is not the work which you are saying. And I can now correlate to it, and these apprehensions and these doubts in the patient's mind can come at any point of time. Now for that, this video I'm going to show you how to count your grafts in a transplanted area. Now Dr. Pranil is going to zoom my implanted area, and we are going to make you understand that how to have a rough estimate about the work done on your scalp, because in this much patch many people have the doubts that how many grafts are there, 2000, 3000, 2500. Some clinic is commenting 5000 grafts, some clinic is commenting about 6000 grafts. Then there are different advisors, there are different social workers who are going to be with you and start putting doubts in your mind. So if you are strong or if you are confident with your clinic, nothing can happen. But most of the patients, they have their own apprehensions. So it's better that you learn to count your own graft. Now this is my work done area. We are zooming the area, and you can see the front line, the wavy front line, each valley and peak which comes, each peak has around 10 grafts. With this assessment from one end, you can imagine that what would be the 100 graft ka patch. That would be somewhere 2 centimeters square or 1.5 centimeters square area for 100 grafts. So with this 10 assessment, you can actually see and count 100 grafts, because that is a doable job which anyone can do. The 100 graft area would be somewhere 1.5 centimeters square area, or maybe lesser than that, in a high density hair transplant. Now visually you can actually cover your area by the multiplication of 100, 100, 100. This is the multiplication of 100 30 times, so it is somewhere 3000 graft. Of course, when your surgeon implants, he will give you everything in written. In a proper clinic, they give everything in written and everything after common discussion with patient and doctor. But if you have a doubt by someone else mention it, or someone else is kind of trying to put something in your ears and you are not confident, then you yourself can take and count your graft by a rough estimate. You can take a picture on a high definition camera, high resolution camera, maybe on a selfie or a kind of proper back camera, and start counting your graft, not one by one, but make an assessment that 1 square centimeter or 1.5 square centimeter area is having this much graft in a high density. So the high density patch has approximately 2000 grafts. As you go behind, the remaining 1000 grafts are spread across a larger area, and that's how you count your graft. and that's how you be happy with whatever is being told to you by your hair transplant surgeon and not get carried away by what other people are saying. And that is the whole purpose of this video, that people are going to put thoughts in your mind. This is not that much, but if you can count your graft, there is no need to take stress. The stress again is going to harm you in every possible sense. So take care guys. Thank you.